It's 26 minutes after 6 on Morning Barbados. I'm Katrina Marshall, live from the Pine. Pearson Boyne is around the Garrison celebrating 36 years. We'll be going backward and forward this morning, but not before I say a hearty good morning to a man who never fails me. I don't know, have you been practicing for 36 years, Doc?
Almost.
Doctor on the line, Adrian Lord. Good morning.
Good morning, good morning, good morning. How are you doing?
I'm good,
okay.
I'm good. Interested in the piece of research you've brought to us this morning regarding that very dangerous but very easy to do practice of having a lovely full Bajan meal, preferably something with macaroni pie, and then going to sleep.
Yes, it's not all Bajan, but it's a study presented at European Congress of Cardiology and Stroke Medicine, which shows that persons who go to sleep within an hour of eating their dinner are more likely to have stroke, or rather, those who wait longer are least likely to have a stroke. So it's a very interesting study. They looked at 500 persons, some who have had strokes and some who have had heart problems, and it showed that eating or going to sleep soon after eating was one of the major factors that contributed to a stroke. But Doc,
your body tells you to go to sleep. You have that sleepy feeling.
You have that sleepy feeling, the postprandial hypoglycemia, or niggeritis.
I have a friend of mine made it PC. She calls it African post-meal sleep syndrome.
Yes, yes, yes. See, most of the blood goes to the intestines for digestion, and little go to the brain, so therefore you feel sleepy. But that is what the science have shown. They did a study, and what it shows that if you waited 60 to 70 minutes, you were 66% less likely to have a stroke.
And for every 20 minutes, your likelihood goes down 10%.
10%, yes.
Oh boy. Have light meals in the evening is all I'm going to say. However, I hope that Marie has not fallen into that trap. She's holding on the line. Good morning. Welcome to the program.
Good morning.
Hi.
Hi. I'm calling because I have an issue where I was diagnosed by a pathologist via a colposcopy, and I had a result of CIN2. I'm 24. So I'm wondering what and how effective a cryosurgery is, so that's what treatment I was given, and the prevalence of my age and how that would affect the treatment that I was given for cryosurgery.
Did you get all that, Doc?
No, I didn't get all of it.
Diagnosis of CN2. She's 24. CIN2, yeah. She's 24 and wants to know what are the implications of that diagnosis on her treatment based on her age, etc.
24.
24.
No, if you have a CIN2, which is a pap smear diagnosis, then it's important to have that pap smear repeated in 3 months, 3 to 6 months. And if you have had it repeatedly, then it's necessary to have a colposcopy, which is a special pap smear, a special investigation is done, which can remove any abnormal-looking cells. What it's saying is that you don't have cancer, but you have some atypical or abnormal cells, not cancerous cells. And it's felt that this can be associated with viruses, like the human papilloma virus, or which can cause warts and may be associated with later cancer of the cervix. So it is important for you to have it monitored closely by your doctor or gynecologist and have your follow-up care, which is very important.
That sounds like a really proactive, know her body kind of caller. I mean, how important is knowing what to look for in test results? I have a friend who, when she's had an MRI, and she can read it, like she knows what she's looking at. And while everyone may not be quite that in tune, how important is it for you to be on the same page as your doctor rather than just kind of swallow whatever he or she says?
Well, it's important to be on the same page, but you have to be careful with overreading. Sometimes there are some things that are incidental findings that we get there, and people get worried about this. Like, for instance, the MRI of the back, it may just show bulging of the disc, and you may be having back pain and think that that may be causing a problem, and the disc between the spine might just be normally bulging, not causing the problem. Because something is there on the result doesn't necessarily mean that is what is causing the problem. So that is the difference between clinical medicine, where we have studied it, and the interpretation of the person who may just Google a result and then come up and then they get worried.
Call us here at 228-5562 or 228-5563. Find us on Facebook. Send us a message if you have any comments for the doctor. I believe we have a caller on the line. Good morning. Hi there. Good morning, Bernice.
Good morning.
Good morning. How are you doing?
Good morning to you and the doctor. I'm doing well.
Wonderful. What's your question?
I want to ask the doctor, I have a numbness every night in my hands, and then going on to morning, and then it goes right down into my feet. And I suffer from high blood pressure. I would like to know what he think is the cause of that.
Thanks, Bernice.
Yes, Bernice, good question. You do suffer from high blood pressure, and I think having numbness in the hand, you're worried whether it's a cardiac problem. It is possible, but it's unlikely. You sound like if you have a little bit of age on you, and it might be possible that you may be having arthritis in the neck and the lower spine, the lumbar spine, that may be causing radiated symptoms from what you would refer to as a pinched nerve. So a nerve coming from the vertebral column, from the spinal column, going through the vertebrae of the neck and the lower back, those nerves may be affected by arthritis, or arthritis may be irritating the nerve. Nerves can be affected by arthritis, irritating the nerve and causing that numbness. And it happens at night, she said?
Yes, at night.
So it could be related to the position that you sleep in. So try to sleep flat and see if that would help. Of course, there's medication that can be used. Heat packs to the back of the neck and spine will help to treat the arthritis. And of course, exercises, that would help.
And if she is going to change her sleep position, she should sleep an hour at least after she's had her final evening meal, okay?
Yes.
I'm still having a hard time with that because, like I said, the body wants to sleep.
But what they say is that when we eat, the blood sugar changes and the cholesterol level changes, and that affects the blood flow, and they think that that is what causes the stroke.
They think?
Yes.
They could be wrong.
Yeah, they say that it's just a theory.
Watch this space, folks. You might yet be able to have your pie and fish and still go back to bed. We were talking about pain in the extremities, circulation, and all those kinds of things. And as you know, we at CBC are trying to change our community one step at a time and encouraging people to get moving, get healthy, and you know, you're a big advocate of that. But we have to look after form, don't we? And making sure that we're doing it the right way. Otherwise, we're kind of shooting ourselves in the foot. And speaking of feet, treadmill versus hard road, gym versus your cart road in front of your yard. The debate continues over which one of those is good for your knees, calves, ankles, your pronation, all of that stuff. Break it all down for me, Doc.
No, any exercise is good exercise, regardless of whether it's in the cart road or in the gym or on the pasture or the neighborhood road or the park. But if you have problems with the knees, it's hard to really run on the surface of the road. So that is a difficulty. The treadmill could be less stressful on the knees because it gives you some padding. So this is an easy thing that you can do by doing your running on the road, which is easy for you if it's convenient. If you have a treadmill, some people can't exercise indoors because they don't like it. So whatever is best for you and your physical condition, if you have foot problems or knee problems, then it might be better to keep off the road.
And always we must stretch and keep those muscles nice and warm. That helps with the tendons. Okay, I feel a little bit better now. Hopefully Jade is feeling better as well. She's holding on the line. Good morning.
Hey, good morning.
Welcome to the program. What's your question?
Hey, good morning, Dr. Lord. I have a question.
Speak up for me, please, Jade. We're not hearing you. Don't whisper. Speak something loudly.
I had a mini stroke on Monday. Doctor said that it was stemming from stress.
We lost her, but she said she had a mini stroke on Monday, which she thought the doctor said was stress-related. I think what she's talking about is a transient ischemic attack, which is called a TIA, where you have paralysis of one side of the body, and it's a temporary thing. It tends to go away within 24 hours, and it could be responsible for symptoms of stress could cause it, high blood pressure could cause it, and so on, but there's not a definite damage to the brain. When they do the CAT scan, they would not have seen any damage to the brain tissue. So it's important for her to keep away from stress if she thinks that is a cause, and keep her blood pressure and other things under control, and then get back into a healthy lifestyle to prevent it from happening. Of course, aspirin may be recommended if she can tolerate aspirin on a daily basis to help to prevent any thrombosis or clotting. And if there are other drugs that are prescribed that can also help with the help to prevent a further stroke or another stroke.
Along with healthy diet and lifestyle, of course. We'd like to say good morning to Tricia, who's holding and has a question. Good morning.
Hi, good morning.
Good morning.
Hi, I'm calling about my daughter. She is 10 years old. During the last week of vacation, her knee slipped out of place. And I want to know if she can play games for the afternoon.
I wouldn't recommend her to play games at school if she had a problem just last week with the knees. The question of the knees slipping out of place doesn't really happen. It is the patella sometimes can be dislocated. The patella is the biscuit, the thing to the front of the knee, that can slip from one side of to the other. So the knees will be a bit sore right now. So she can get an excuse to be off games for another week. And but she needs to exercise, because building up the muscles around the knees are going to help to prevent this problem. But right now she will be on anti-inflammatories and using ice packs on the knees to prevent the soreness. But I wouldn't let her play games this week. I think, well, the doctor should have advised at least a week off games, and then she should get back into that.
Doc, once that patella has slipped, or rather the bone behind the patella has slipped, are you at greater risk of it happening again more frequently? Yeah,
it means that the tissues there are slack, and therefore you are at greater risk. So by regular exercising, squats and things to build up the muscles around the knees, that will help to prevent it. If it is recurrently slipping, then she needs to see an orthopedic surgeon, who will then be able to correct the problem once and for all.
Is there any temporary solution for, let's say, people who just either cannot afford it or don't have the time to rest or sit out, people who are in perpetual training for something or the other, whether it's, I've seen these very elaborate knee braces that look like something out of Star Trek, and then there's now spider strapping, which simply looks like black electrical tape in the right position to keep muscles in place. Or is that part of an overall treatment regime that
that's
you can
part
employ?
of an overall treatment regime, but a knee brace could be used to support the problem.
Okay. Well, if you have your knee brace in place, if your patella has slipped, you're good. If you have had your meal late at night and you can spend an hour watching something on perhaps CBC TV 8 and let that digest so you're not in increased risk of stroke, you're good. And it's always good to have you, Doc. That's all we have time for today. Thanks a lot for joining us.